Good morning, this is Key2. Today is February 1st, first day of February, and I'm very excited to have Dr. Nina Walsh with us here. And I'm very grateful to have you, and especially the reason I'm excited is because as we take the journey together, doing the podcasting together, I'm going to be learning a lot about your wisdom, your knowledge that you are transforming and putting it together, what you are learning from the Western medicine, and then you're putting the Chinese, the traditional, and also some of the Eastern European traditional medicines. So I look at it as this non-stopping spring. The water comes out. So we will take small steps, and we will take our journey and then learn little bit by little every day. And so today, it's a continuation of last week's our talk about the beauty, how we're gonna achieve the beauty from inside.
Yes.
Is that right?
Hopefully from inside out.
Yes. So today we have many topics we discussed, Dr. Nina and me, but today we'd like to focus on what is when you look at the label on the beauty product, what do you need to know to be conscientious about, is this safe or is this not safe for me? And since you're going to put it on your skin, we briefly mentioned about when you put anything on your skin that goes into your body and affects your central nervous systems everywhere. And so you need to know when you put something on your body, whether it's safe or not, just like when you swallow something, right?
Very much, yes. So I would like to thank Hiju, of course, for inviting me again, and I'm very happy to continue our work together and continue to serve our listeners. And yes, skin health and beauty is of particular interest to me because I have a lot of patients who are women, and not only women are interested actually in maintaining healthy skin, because skin is the first thing that we think about, right? When we look at the first thing that we notice, they're so beautiful. And so throughout ages, actually, the beauty and health of skin has been considered a focus and a value. It's a reflection of internal health. Right. It's a symbol or a sign of health and fertility, right? And it was also an inspiration for poets and artists and all. And so looking at skin, we understand that skin is of course, largest organ in the body, and it has many important functions, and therefore it has very special structure, right? So it is also a rapidly renewing organ. We shed many skins, so to speak, throughout our life.
How fast does it rejuvenate? You get a new skin.
It depends, actually. It depends on the particular structural components, but we lay new collagen probably every 6 months. So it takes about 6 months to create, new collagen, which is a major structural component which gives the skin its elasticity, and strength. So, and skin is also very sensitive to nutrient status. So if we have a deficiency, nutrient deficiency, then that will be expressed on the skin. If we have toxicity, if we have issues with digestion, for instance, that also will be expressed on the skin. And so skin gets the surplus of nutrients, so to speak, so after all the vital organs get what they need, skin gets what it needs, because that's not, even though it's a large organ, a very important organ, it's not the most vital organ, and so there is a priority, right?
And I heard that some of traditional Asian medicine, that the doctors will look at your skin conditions and they can diagnose, your condition, especially like your tongue or your eyes, that's the skin too. Correct. And then you can tell your health.
Right. So actually, the entire face is diagnostic. We'll look at different areas, different parts of the face for discoloration, blemishes. Yes, exactly. And that is reflective of a corresponding organ or organ system, actually. So that's true. The face and the tongue are diagnostic. And so what is important in skin that the collagen and elastin fibers and water are retained, so we have abundant and properly structured collagen, so straight and evenly distributed collagen fibers versus tangled sort of fragments.
Yes.
And this is what happens when the skin is aging. So that's what happens, and that's a reflection actually of not only internal nutrient status, nutrient deficiency, also maybe toxic burden, also maybe some inflammatory processes going on in the skin, but also the effect of the environment. And in the environment, we can consider many factors such as the sun, of course, and some harsh treatments like radiation that people go through sometimes, and also what we put on the skin. And so in that sense, it is very important because, as you mentioned, the skin is also how we take substances in, and that's why indeed, the beauty industry is so successful, I guess. Cosmetic industry is thriving. Right? Yes. We always want that special ingredient, that special miracle cream that will keep our skin beautiful and firm and plump, without wrinkles and so on. And there are many, many ingredients on the market now that are being used, both natural, naturally derived, and completely synthetic. And so it is important to understand and decipher, what actually is helpful and what is not so helpful and what may be harmful.
Right.
And so...
So then the question will be, as someone like me, when I look at the, let's say I'm trying to buy a product, I'm looking at the label, the ingredients list, and then what kind of judgment am I using to know whether this is safe or not? What do you do?
I have a colleague, a naturopathic doctor as well, who has the rule of the four-year-old rule when he evaluates food. Right, like packaged food or just food items, and so he says basically, if a food item has a label, and this label has ingredients that a 4-year-old can't pronounce, then that is food. Anything that is not possible for a 4-year-old child to pronounce may not be a good idea to eat, to put in your body. And I think something similar we actually can apply to the ingredients on cosmetic products. And so the basic principle is the more the natural the ingredients are, and actually sometimes even fewer components are better, although that's not always the case. But the more natural, the more understandable they are, the more common the word is, right? The more familiar. But again, there's an exception. Sometimes there's something more exotic and just more unique. But then the better it is for you because, we have existed in this environment for millennia, right? And so our body understands how to utilize, how to deal with natural substances. And synthetic ingredients have been around for a much, much shorter time. And we simply don't have enzymatic pathways. We simply don't have mechanisms to utilize those and sometimes even to detoxify those.
To get rid of
your
body, right?
Right. Yes. And so a big theme of environmental toxicity does include environmental toxicity from body care as a major it's a major topic,
And also household cleaning.
Correct. So anything that we put in our body, anything that we come in contact with, deliberately or not, occasionally or on a regular basis, does affect our health internally in general, and not just at that moment, but actually for a long time, and sometimes even crossing over to the next generation.
Yes.
And so, so in the beauty industry, of course, labels. Beautiful labels are kind of a big deal, right? So when I come over to a cosmetic counter at a department store, there's so many beautiful packages and beautiful jars and everything.
Containers, packaging.
Right, and the salesperson will give you a great story, and they will tell you about all the miraculous properties of these. But then when you ask them, what does it have in it? And they will emphasize certain attractive ingredients. The ingredients are actually, they're meant to do something good for your skin. But then there are all kinds of ingredients around that we can't even read. And so for an active ingredient, some like witch hazel, for instance,
Right.
or sea buckthorn oil, or vitamin E, or ginseng extract, which are really wonderful, health-giving, health-promoting substances for skin. But sometimes there are many substances around them that are used to create a particular consistency of the cream, of the
or
lotion, yes,
Right.
or shelf life, promote a longer shelf life, or enhance the delivery of this product into the skin. And so these are important. However, the substances that are used very often are harmful.
Right.
And so some of the things to look at. And so a good idea is to always turn around, that beautiful package where you have a beautiful image.
Yes.
And look at the list of ingredients. And it's very, very often very long. And if it starts with something that you cannot read, you might want to just put it away altogether and not even worry about it. And specifically, the kind of things that we'll look for, of course, are parabens, for instance, right?
Yes.
Parabens, again, are used, to create particular consistency.
Or to preserve the cream.
And preserve the cream. So things like, and parabens, of course, we know, now they have been shown to have very pronounced carcinogenic effects. And not just skin cancer. We think that maybe these items accumulate in the skin or just underneath the skin layer. No, they actually go deeper in the body, and a lot of them are stored in fat, and they become metabolically active, as in they interact with our body's metabolism in a detrimental way. So they turn off certain important pathways, and so like in hormonal functioning, they do affect our hormonal system that way. Another one, and so parabens, of course, are a very well-known substance, and we don't want them in any of our products. I mean, not at all. And a lot of producers are very conscious of that now, and so high-quality product will not have those.
Yes, so for us, like, compounding, also with the one of the reasons that we compound is because some commercial product does have parabens in them. Some injectables or some creams, a lot of products have them. And then the doctors, our doctor and patient, who are very conscientious about not putting those things in their body, then they will write a prescription for the patient, and then we will compound without that. So we call it paraben free.
Correct.
Basically.
Hormones are a good idea.
Yes.
A good example.
Yes.
Right? Compounded hormone creams.
Yes.
Yes, definitely. So then EDTA is another substance to stay away from. EDTA is another carcinogen also, and it tends to accumulate in the fatty tissue, but it also can be deposited in the structural components of the body, like skeleton. And so the problem with these ingredients also, they're not very easily detoxified from the body. So they stay for a long time, and they have a lasting effect. They exert that,
That's very interesting. The EDTA also, we compound that for chelation, for remove, actually, heavy metals.
When you specifically use EDTA for chelation, just as a pure substance in a targeted way, in a specific, precise protocol, yes, it does have that effect. Yes, but when it's part of the
like a cosmetic product, something that every day you put it on your body,
right? And it, like you used to see that in soaps, and even now, a lot of in the commercial soaps. So then, just like with food, anything that has artificial, like artificial synthetic fragrances or synthetic coloring. Those also have a tendency to be disruptive for our endocrine system and for our metabolism and for hormonal system. Another substance I wanted to mention is hydroquinone. Hydroquinone is one of the staples in the cosmetic industry that is used for deep depigmentation. Exactly. When we have what is called age spots sometimes, or liver spots, or whatever, and or pronounced uneven pigmentation after excessive sun exposure. Hydroquinone has that property, but it is also a very, very toxic substance. And actually, when they handle hydroquinone as I guess as cargo, for instance, when they even ship it to the manufacturer from to the producer of cosmetic substances from the manufacturer. It is handled by people in hazmat suits.
Because it's hazmat.
It is hazardous material. Yes, so you can't touch it, and yet it also has properties to drive the to reach a deeper layer in the skin. So it has that function of bringing the ingredients into deeper layers. So being hazardous, it also penetrates deeper. So it's kind of doubly dangerous. And so hydroquinone is a proven carcinogen as well. So
so that's also very interesting. So I'm trying to put some different perspective on this. And also hydroquinone is something that we will compound. But just like EDTA, that if you use it appropriately, it can have the benefits. So truly, some people do have dark spots and like that. You can use hydroquinone localized way under the doctor's supervision to your skin, and it can change that you can look for the outcome that you're looking for. But I think what Dr. Nina you were talking about is that constantly having that as an ingredient and putting it all over your face, that's something you don't want to do.
It is definitely a concern. I would definitely stay away from it. And we also know now with today's research that there are natural substances that have those properties as well. Like licorice, for instance, is a very effective depigmenting substance. And there are many others, like ellagic acid in pomegranate, for instance. And so these also have beneficial effects on many other levels. Another thing, anything that has methyl or propyl and aldehyde in it. So these are all synthetic substances derived usually from petroleum-based products, something that
like solution
does not belong does not belong in our body whatsoever. And at a minimum, it accumulates and just kind of adds to the toxic burden and makes it harder for our body to eliminate all that waste. But very often these are actually actively harmful ingredients, and I already mentioned that they are not so easy to eliminate. They persist. Some of them are called persistent organic pollutants because of their structure, and they persist in the body. So they're sort of the pace with which they get degraded is very slow. So they take a long time to get degraded, and they're also protected if they're stored in the fat. It's not very easy to get
it out.
The fat is not meant to be so easily accessible by the body. It's storage of energy, but it's also storage of toxicity oftentimes. And
which brings up a good point when we do a weight loss. And all of a sudden losing so many pounds all at once, that there is that danger getting all those toxins out.
Yes, and the person may experience, feeling very, very sick actually. And so it's always a good idea to do a good, thorough detoxification regimen before you approach weight loss. And always a good idea to do weight loss in a steady, sort of gradual way. For that reason. Another point I wanted to bring up is that so we know that these ingredients are harmful individually. But they have never even been studied for their action together. And there are reasons to believe that together they create an even more harmful concoction. So it's sort of like the opposite of natural substances, which they're beneficial individually, but together they create an even more beautiful, healthy synergy. Whereas these toxic substances, they become even more harmful in combination, and that we don't even know, that the actual long-term effects of that. So,
so it might be a good tool for our listeners that, there are a lot of things we don't know. As we, just like what you said, individually we know something, but then when we put it together, we don't know. So as a consumer, right, someone that you use this product every day, maybe there might be some signs or some way for you to be aware and maybe take some steps. For example, what I'm talking about is that if you are a person have been using a lot of this cosmetic product, let's say last 20 years, and then now you're learning that can be toxins to your body, can be stored in your fat cells, and it can slow down your liver functions and your GI functions and your neurological systems show up on your skin, right? So those will be the signs, right? Whether you get constantly have something on your skin, your digestions, or you're sluggish, and your eyes getting yellow, and a lot of those things can be shown, and the signs, and then there's something that you can find the right doctor, someone like you, and then do something about that, and then take the right steps to do it.
Right, yeah. We often say that there is actually no skin, or there are hardly any skin issues without gut issues. So yes, definitely it's a reflection of how digestion is functioning, how well our liver is, dealing with detoxification, and many other organs as well. But that goes true for the rest of our health as well, and that's why our approach to beauty is holistic.
Yes.
So that we can produce and regenerate beautiful, healthy new cells from within. And there are things that we can do from the outside, topically as well. Being wise and using good, healthy, well proven, well researched approaches, and natural approaches. And so I often recommend that people look for natural and also organic ingredients, and those you will see bolded typically on the ingredient list.
Okay, so today we'll stop here, and then maybe next time we will look at more into the organic. Why is it important even for your beauty?
Sounds wonderful.
Okay, great. Thank you so much, Dr. Nina.
Thank you. It's a pleasure.